Hey guys, welcome to my video on an approach to lower back pain. And I want to remind you to please subscribe. So now on to my approach. So say you have a patient who comes in with complaints of low back pain. And say it's pain, that's just pain. And you have a suspicion that the pain is secondary to a more severe illness. You're going to try and unmask it with an X-ray. Now, when I say unmask, I mean the M stands for a malignancy. So you suspect that the patient actually has cancer, and that's causing the low back pain. AS is for ankylosing spondylitis. And in ankylosing spondylitis, that would be a pain that gets better when the patient walks around and is probably most present at night. And the C in this stands for compression. So you're suspecting compression fracture due to osteoporosis. It's usually due to osteoporosis. So in those cases, you're going to get an X-ray of the spine. Now, this is if it's just pain, but suspicious. So if it's just pain, non-suspicious, you send them home with acetaminophen or an NSAID. Okay, so what if it's pain, but there are things that obviously point to the spinal cord? So you've got pain plus some kind of sensory or motor problem. Or a risk factor for CNS abscess. You're going to do an MRI. And now back up here to this case right here where we unmask. So if you're trying to unmask what's causing the lower back pain that's suspicious, and you indeed have an abnormal, so if this is abnormal, you're going to go to an MRI. But in the case of pain that obviously points to the spinal cord or the CNS, like pain with sensory or motor deficits, or something that suggests cauda equina syndrome, or someone who's an IV drug user where you're suspecting epidural abscess, you're going to pick the MRI first. And you've reached the end of my video.